How to use Clomid to get pregnant. In today's video, I'll be talking about what Clomid is used for, who benefits from Clomid, the dosage of Clomid, and the proper way to take Clomid in order to get pregnant. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything in fertility and women's health. So if this is the kind of content you're interested in, keep watching. Clomid is a medication used to treat infertility in women. It works by stimulating the increase in the level of hormones called FSH and LH in order to promote the development and the release of a mature egg. And remember, that is what we call ovulation. So it helps to support ovulation. Ovulation is simply the release of a mature egg from the ovaries. So who benefits from Clomid? So the first thing you should know is that it's not every woman that is experiencing infertility that would benefit from Clomid. Clomid can be used for women that have been diagnosed with unexplained infertility. Unexplained infertility is simply when you and your partner have done all the fertility tests, you've been evaluated for fertility, you've been investigated for the cause of the infertility, and everything seems to be fine, but you're still finding it difficult to conceive after you have actively tried to get pregnant for at least 12 months. In this case, Clomid may be beneficial. Women with unexplained infertility still ovulate. So the goal for women with unexplained infertility when we're using Clomid is something we call super ovulation. That is, we want to stimulate the ovaries to produce multiple eggs in order to increase your chances of success with Clomid. Clomid is also prescribed for women with irregular ovulation or absent ovulation. That is, their ovaries do not release egg, or their ovaries release egg maybe 4 to 5 times in a year. For example, in women with PCOS. PCOS is polycystic ovarian syndrome. Although current research has shown more support for letrozole in the treatment of infertility with women that have PCOS, Clomid has been used for a long time historically in treatment of infertility in women that have PCOS. So even though letrozole is more favorable, Clomid can still be used to achieve success in the treatment of infertility in PCOS patients. So who does not benefit from Clomid? Clomid is not recommended for women whose ovaries no longer produce eggs properly or no longer produce eggs at all. For example, in women who have been diagnosed with primary or premature ovarian insufficiency or failure. The first step to using Clomid is to visit your doctor for baseline tests. I say this in all my videos. Before you use Clomid, visit your doctor for baseline tests. Your doctor will test for hormones such as follicular stimulating hormone FSH, luteinizing hormone LH, prolactin, estrogen, progesterone, and even other hormonal tests like thyroid stimulating hormone, thyroid function tests. Your doctor will also do other tests for you like ultrasound scan, hysterosalpingogram to check that your tubes are patent, and every other fertility evaluation that is necessary for you before your doctor can now decide whether you would benefit from Clomid. The ultrasound scan is very important because your doctor needs to check if you have a growing follicle or a large follicle. That large follicle is an ovarian cyst. So we need to know if you have an ovarian cyst. Once we see an ovarian cyst, we can't start you on Clomid because Clomid will cause the cyst to increase in size. But when we do this ultrasound scan for you and there is no cyst in your ovaries, then we can start you on Clomid. Also, one of the reasons it is super important to see your doctor for baseline investigations and evaluation is so that your doctor can decide what dosage is necessary for you. Because Clomid doesn't have just one dosage. There are several dosages for different individuals. And proper dosaging is important for you to actually see the effects of Clomid. So imagine that you require like 100 milligrams per day and you're currently taking 50 milligrams per day. You wouldn't see the effect of the Clomid. That is why proper dosaging is important. Generally, clomiphene is taken by mouth for 5 consecutive days early in your menstrual cycle, starting from either day 2, day 3, day 4, or day 5 of your menstrual cycle. So when you begin to see your period blood, you start clomiphene either day 2, day 3, day 4, or day 5, and you take it for 5 days. Like I said, it has to be taken exactly the way it has been directed by your doctor in order for you to see the effects. It comes as a 50 milligram pill, and that is the lowest dose you can take per day. You can take up to 100 milligrams per day, that is 2 pills per day, or you can take up to 150 milligrams per day, that is 3 pills per day. You can take up to 200 milligrams per day, that is 4 pills per day. Your dosage is based on your medical condition and the way you respond to treatments. Don't take it more often or for a longer period than prescribed by your doctor. Long-term treatment with this medication is not recommended. Follow your doctor's instructions diligently, and if you have any questions, don't hesitate to ask your doctor. Usually, dosages can be adjusted based on your response to treatments. When you're on Clomid, monitoring ovulation becomes necessary. So there are several ways your doctor will monitor your ovulation. One is by the use of ultrasound scan. So by the time your doctor places you on Clomid, you'll be invited for an appointment 6 days after you started the drug. So on the 6th day, you're coming in for ultrasound scan. This ultrasound scan, we are checking the ovaries to see how the follicles are developing, how many follicles are growing, what is the size, we're measuring it, and then you have an appointment every other day. So if you come on day 6, the first day, you have an appointment for the 8th, day 10, day 12, day 14, and that is how we monitor your ovulation. So by measuring the follicle, it gives you an idea when your follicles have matured and when you're about to ovulate. So by the time we start seeing a follicle that is measuring 16 millimeters, 18 millimeters, 20 millimeters. This is around the period you should start having sexual intercourse actively, because the follicle can rupture anytime from 16 millimeters and above, and you want to be prepared. Remember, sperm can live in the female reproductive tract for up to 5 days. So when we see that the follicles are maturing, this is when your doctor recommends that you start having sexual intercourse regularly. Also, your doctor may recommend that you use ovulation predictor kits. So you can get this in a pharmacy, in a store, in local shops close to you. And what this test kit does is that it detects a hormone called LH, luteinizing hormone, that surges in your blood 12 to 36 hours before you ovulate. So if you are testing every day or every other day with this test kit, the moment it is positive, it means that it has detected the hormone LH in your blood, and that within 12 to 36 hours, you will be ovulating. So the best time to have sexual intercourse is 24 hours from the time that you see a positive test result. When taking Clomid, it is important that sexual intercourse happens at the right time, at the proper time, in order to increase your chances of getting pregnant. So before you take Clomid, it's important to know the potential side effects. Like any other medication, Clomid has its own side effects. I'll start with the most common side effect, which is multiple pregnancy. The higher the dosage you take, the higher the chances of having multiple pregnancy. Multiple pregnancies comes with its own risk, so we are usually careful with the dosaging of Clomid. Other symptoms include bloating, that is feeling of bloatedness, and stomach or pelvic pain. Some women may have leftover ovarian cysts from the previous month's treatment cycle. And if this happens and the last treatment was unsuccessful, then you can't start a new treatment until the cyst resolves. The cyst is not harmful, it usually resolves on its own. Other symptoms may include hot flashes, mood swings, changes in cervical mucus. Some of the rare side effects include blurred vision, vision changes, or any vision symptoms. And when this happens, it could be an indication that a stroke is about to happen. But this is usually a rare symptom. Generally, most women tolerate Clomid well. While you're on Clomid, if you experience any unusual symptoms or any uncomfortable symptoms, communicate with your doctor immediately. Open communication is key throughout your fertility journey. Clomid has good success rates. About 70 to 80% of women will ovulate with Clomid. However, ovulation is just step one because fertilization still needs to occur, implantation still needs to occur. But as per ovulation occurring, about 70 to 80% of women who take Clomid will ovulate. The chances of success of pregnancy with Clomid after several use is approximately 30%. But of course, this varies from woman to woman depending on the reason you're using the Clomid in the first place, depending on your medical condition, depending on your associated conditions. Generally, Clomid has shown success for many. If after a few cycles you've still not gotten pregnant, it is time to reassess and consult a fertility specialist because there could be other factors at play. Clomid is a valuable tool, but personalized guidance is key. Remember, everyone's fertility journey is unique. Stay positive as always, and I am rooting for you. If you found this video informative and you want more content like this video, subscribe to my channel, share with your friends, and see you in my next video.